Your life now, and you know, things can get really crazy during an emergency. So how do you decide if you should go to the ER or maybe just go to urgent care?
We are joined by Dr. Rick Shimp, Medical Director of Columbia St. Mary's Emergency Services, and we appreciate you being with us, Dr. Shimp. And this is not an easy question, but what are some of the situations that might say you need to go to the ER?
Sure, it can be very difficult for patients to make the decision. So I would offer 3 situations in which folks should seek medical care in an emergency department. The first and the most obvious is limb or life-threatening emergencies or conditions that knowingly will have consequences if they're not cared for immediately. And that would include psychiatric problems such as depression, thoughts of suicide, or behavioral changes that may be a medical emergency. The second is at the advice of your primary care physician or other medical professionals. It's not unusual to call your primary care physician seeking advice. If the recommendation is to use the emergency department, that is completely appropriate. And last, and by far the most common situation, is less severe symptoms that may be indicative of a severe emergency. So chest pain, shortness of breath, abdominal pain with fever, something that we deal with all day long. And like I said, that's the most common situation. So there are resources. You can call your primary care physician. You can call the urgent care clinic or the triage nurse line to get that advice. But if you're concerned it may be a serious illness, those are the times to come to the emergency department.
Things can get kind of frantic in an emergency situation like this. If you have time, are there some specific things you should try and grab, paperwork to take with you?
Absolutely. The more information you or your family can bring for you, the better care and the safer care that we can provide. So on top of the list of items would be your medications, even a paper list of medications, a list of allergies, and really your past medical problems. It's not uncommon. We don't have any of that information, and when quick decisions need to be made, we do entertain risk by doing that. So the more you can provide to us, the better care we can provide.
Very important, and you need to let the loved one or anybody next to you, a neighbor or someone, have that information as well, just in case they might take you there. Well, Dr. Rick Shimp, we really appreciate you being with us this evening.
Thank you.
Thank you, sir.
Well, up next we're going to introduce you